Employers are looking for ways to attract and retain a stable workforce. For some, that includes shifting policies to assist people in recovery from substance use disorder. They're broadening their perspectives and practices to support the unique needs of those in recovery, including the use of prescription medication called medication-assisted treatment, or MAT, to treat substance use disorder. We now know that substance use disorder is a chronic medical condition that affects the brain's ability to function normally. Much like other behavior-related diseases like heart disease and type 2 diabetes, it can be complex to treat, but MAT is a proven way to treat the disease. Most often used in treating addiction to opioids, MAT addresses both the symptoms and underlying causes of the disease by combining therapy to help build skills needed for recovery with prescription medications like methadone and Suboxone. The medication used in MAT help normalize brain chemistry and body functions, block the effects of the drugs, meaning the high, and help reduce cravings and painful withdrawal symptoms. And they can be used during all phases of the recovery process, from initial detox through long-term recovery. Research shows that people undergoing MAT have better outcomes than those not participating in MAT. And those who participate in this type of treatment for at least 1 to 2 years have the highest rates of long-term treatment success. Employers who understand and accept the use of medication in addiction treatment are headed in the right direction of supporting employees in recovery. Yet despite decades of evidence proving this treatment is effective and safe, myths about MAT persist. Some people criticize MAT, saying it's just trading one drug for another. But the fact is that MAT uses safe, FDA-approved drugs that don't have the same negative and euphoric effects, meaning the high, as illicit drugs. And according to the Substance Abuse and Mental Health Services Administration, the proper use of drugs used in MAT has no adverse effects on a person's intelligence, mental capability, physical functioning, or employability. Another common myth is that MAT increases the risk of overdose, but it's actually been shown to decrease the incidence of relapse, thereby the risk of overdose. Remember, these drugs are FDA-approved prescriptions and used and monitored in therapeutic doses. Also, some wrongfully think that MAT is expensive and not covered by insurance. But the truth is that most Medicaid, Medicare, and private insurance plans do cover it, though prior authorization may be needed. Finally, critics think the medications used in MAT should only be used short-term. But research shows that the longer a person is engaged in it, the better their rate of long-term success. And when you think about it, long-term use of these medications is no different than long-term use of other drugs, like for controlling high blood pressure or regulating blood sugar. Bottom line, it's up to the patient's doctor to determine how long the medication should be used to reach the person's treatment goals. So it's important for employers to see through these myths and protect the rights of employees to participate in MAT. But at the same time, many prescription medications carry the risk of side effects that could impact an employee's ability to do their job, which means employers need to balance the rights of the employees to take the medications with their right to establish a safe and productive workplace. Establishing a drug-responsible work culture is critical in ensuring medication use, including those used in MAT, does not jeopardize the safety and productivity of the employee or the workplace. And at the core, a comprehensive drug-free workplace program with these 5 important elements. A written policy in operations with a legally sound prescription drug rule protects the rights of an employee around taking medications. Think the Americans with Disabilities Act. It also protects the rights of the employer to have a safe and productive workplace. This rule should outline an employee's responsibilities when taking a prescription medication, like asking their doctor about possible side effects and alerting the employer if the medication could pose a safety risk. And it should also outline actions an employer might take if there are safety concerns, maybe removing the employee from safety-sensitive functions or asking for a fitness for duty exam. Drug testing can be an effective tool to prevent and identify substance misuse. This is especially relevant with employees in recovery, as the thought of being tested might just be that extra incentive they need to stay the course. That's why many employers choose to include random and follow-up testing in their policies. And it's also important to include a medical review officer or an MRO in the testing process. This way, the MRO can verify if a drug in the system is being taken legally and appropriately, and if it is, will rule the test negative. Remember, drugs used in MAT are legitimate medications for a legitimate medical condition. Annual employee education reminds employees about your drug-free workplace program, including when they could be tested, and about your prescription drug rule. And it's the perfect time to educate them about the available helping resources. Annual supervisor training ensures leadership knows how to spot and respond to potential problems and is an opportunity to educate against any stigma that might be getting in their way too. Finally, employers need to have resources available to help an employee who shares they're struggling or is identified by management or a positive test that there's an issue. An Employee Assistance Program, or EAP, for example, can provide counseling and other resources to employees who may need it. And this helps employers stay focused on running their business. Employers aren't expected to diagnose or counsel employees about their medical conditions or the use of prescription medications. Their role is to maintain workplace safety and productivity and to lean in on those helping resources when faced with an employee's physical, behavioral, or work performance issues that could be tied to a medical issue. So as we're wrapping things up, remember, using prescription medications in the treatment of substance use disorder has been proven effective, and employees have the right to take them. But the stigma around MAT can provoke employers to make decisions based on myths, unfounded assumptions, and stereotypes, instead of responding to this disease like they would any other chronic medical condition. Stigma not only jeopardizes the rights of employees in treatment, but can also jeopardize their success in treatment. But employers, you have rights and needs too. So continue learning about MAT and the needs of your employees in recovery. Ask for help from professionals who understand the disease and treatment approach. And be sure to have sound practices and policies in place to build a safe, productive, and drug-responsible culture, a culture that will attract and retain excellent workforce.